Welcome to Sidelined, your dose of analysis on the biggest injuries and conditions affecting sports today. Featuring insights from the doctors of Palm Beach Health Network Physician Group in partnership with ESPN West Palm. Now, here's your host, David DePino.
Hello and welcome to the SIDELINED Podcast. I'm Michelle Shugarden for David DePino. On this podcast, I'm speaking with Dr. Arif Dalvi. Dr. Dalvi is a board-certified neurologist, the director of the Comprehensive Movement Disorders Center at the Palm Beach Neuroscience Institute, and physician chief of the Movement Disorders Program at Delray Medical Center. Dr. Dalvi is an expert neurologist specializing in the treatment of a wide range of movement and memory disorders, including Parkinson's disease, Alzheimer's disease, and dystonia. On this podcast, we are talking to Dr. Dalvi about Parkinson's disease. Thank you, Dr. Dalvi, for joining us today.
Thank you for having me on.
Great. So let's get to it. Even though legendary boxer and activist Muhammad Ali did not receive a diagnosis of Parkinson's disease until age 42, according to Parkinson's News Today and ESPN, he showed signs of the disease in his early to mid-30s. Also, Michael J. Fox publicly disclosed his Parkinson's disease diagnosis at age 29. So Dr. Dalvi, what is the age range of someone to be diagnosed with Parkinson's disease?
So the most common age range is 55 to 65 at onset. In my own practice, I have a large number of patients in their 40s. So we call them the young onset Parkinson's group. And in fact, the youngest patient I've ever diagnosed was 19 when she was diagnosed and had a specific gene mutation called the Parkin mutation that predisposes to this early onset.
Wow, that's very young. Another topic locally, former Georgia Bulldogs and Miami Hurricanes head football coach Mark Richt announced his diagnosis with Parkinson's disease. An interesting fact, Richt is 61. He played high school football as a quarterback at the Boca Raton Community High School. In a recent USA Today article, Richt noted he felt that stress from being a college football coach was a big risk factor for his Parkinson's disease. Dr. Dalvi, what are the risk factors for Parkinson's disease?
So the major risk factors are genetic mutations. Certainly in some ethnicities, genetic mutations have a very large prominence in terms of being causative factors or risk factors. For example, if you're of Ashkenazi Jewish descent, and there's about 33% possibility that you may have a mutation called as the LRRK2 mutation, which can give rise to Parkinson's disease. There are other genetic factors. We are now up to well over 18 or 20 such mutations that have been identified, and that's not the end of it. However, environment can also play a role. Repeated trauma, head injuries can play a role in bringing out the symptoms of Parkinson's disease. Certainly, there are certain environmental toxins that can also raise the risk of Parkinson's disease. So one way of describing it is that the genes load the gun and the environment pulls the trigger. That's how it's been described.
Wow, very interesting. So could you tell us a little bit more about what the signs and symptoms of Parkinson's disease is?
So the four main symptoms, we call them the TRAP symptoms. That's the mnemonic that we use to teach medical students. So T is for tremor, which is shaking of the hands. And typically this shaking happens when the hands are at rest, not while holding things in Parkinson's, as opposed to essential tremor, where the tremor is showing up most when you're holding objects in your hand rather than at rest. The second is rigidity or muscle stiffness. The third is akinesia or slow movements, or bradykinesia is the more accurate term. And the final is difficulty walking. So shuffling gait, short steps, these can be signs of Parkinson's as well. There's a whole host of other subtle features you might see in the early days, change in facial expression, soft voice, or even something as subtle as diminished arm swing on one side compared to the other, these can give hints as to whether a person might be having Parkinson's disease.
So when should someone see a neurologist for Parkinson's disease if they start seeing any of these symptoms?
So if you have any of these symptoms, it's worth consulting with a neurologist, I would say right away, for a number of reasons. One is not every tremor or shake is Parkinson's disease. There are other conditions that can cause Parkinson's for which the treatment might be very different. The second is the sooner you're diagnosed, the better we can put together a protocol, not just of medical treatment, but also of a preventive approach in terms of trying to slow down the disease progression. Although there is no medication as of now that has been FDA approved and proven to be efficacious in terms of slowing disease progression, certain lifestyle measures can be advised with respect to diet and exercise, which can be very helpful in the early years.
So there are things we can do to help reduce the risk of Parkinson's. That's good to know. I know there's a lot of exciting new medical treatments. Can you tell us about some of the medical treatments for Parkinson's disease that are available today?
So there's a range of treatments that are new. I'm going to talk about some medical treatments, but also some advances in surgical treatment. On the medical treatment side, a lot of patients, they respond very nicely to the main medication for Parkinson's, which is levodopa or L-dopa. And they have sort of a honeymoon period of 5 years of 7 years when they respond to this medication, 3 or 4 doses a day. But over time, they find that the dosage lasts for shorter and shorter durations and sometimes can unpredictably fail to kick in or wear off before the next dose is due. So for these patients, to have a rescue medication is very helpful. So there are new treatment options in the form of a levodopa inhaler that we have started to use as rescue medications for these patients. There's also a strip that is very similar to the Listerine strip you might use for bad breath, but it is infused with a compound called as apomorphine that acts as a rescue medication. So somebody who's having tremor can go from an off state with the symptoms being visible to an on state within 10 or 20 minutes, as opposed to taking a tablet, which can take an hour to kick in. So the rescue medications have been a big new development in terms of how we handle the disease state once it has passed that honeymoon period. But the other approach for these patients as the disease progresses is to offer surgical treatments. And at Delray Medical Center for the last 6-7 years, we've been very busy with deep brain stimulation, which is very effective, especially for symptoms like tremor, muscle stiffness, and reducing the on-off fluctuations with the medications. But we are now looking into a new technology called focused ultrasound. And the idea behind focused ultrasound is to offer brain surgery without going to the operating room. So that is the novelty behind the procedure.
That is just amazing. Can you please tell us more about focused ultrasound and how patients are treated without going into the OR?
So the concept is just like you might take a magnifying glass and focus the sun's rays onto a leaf, and then because it is concentrated at that point, the leaf starts to burn. We use ultrasound rays and focus it to a small point in the brain using this technology. And this allows us to make a lesion in the area of the brain that has tremor cells or is overactive and gives rise to the main symptoms we talked about. Unlike with DBS, where we have to drill a burr hole, put a wire in the brain, then put a pacemaker underneath the collarbone, all of which requires incisions, with focused ultrasound, the entire procedure is done without a single incision. So patients are awake during the procedure. They're constantly being tested in terms of improvement of tremor. And the improvement is same day improvement. There's no further adjustment period involved, unlike with DBS. And also patients go home the same day. There's no hospitalization involved. So for a number of patients, before considering DBS, they may want to look into focused ultrasound because this allows incision-free approach. And if later as the disease progresses, if they're not responding to focused ultrasound, they always have the option of going for DBS, whereas you can't do it in the reverse sequence.
That's just amazing. Surgery without going into the OR. That's incredible. Is there anything else you want to add about Parkinson's treatments, diet and exercise?
I think one of the things patients also should really focus on is the cognitive aspects, because with Parkinson's disease, yes, you have physical symptoms, but there's also cognitive aspects all the way from anxiety and depression to difficulties with short-term recall and sometimes even troubling symptoms like hallucinations in later stages. So going to a movement disorder specialist who's going to look at you in a holistic way and examine and ask for the right questions with regard to all of these areas, and then come up with the best sort of team approach that addresses all of these issues is one of the best ways of maximizing quality of life in somebody with Parkinson's disease.
Amazing. So thank you, Dr. Dalvi, for joining the Sideline Podcast. We've heard a lot of great information today. Thank you for sharing this important information on Parkinson's disease. And I also want to thank our listeners. For more information on Dr. Dalvi, please visit pbni.com or call Dr. Dalvi's office at 561-572-9371. Dr. Dalvi's Palm Beach Neuroscience Institute office is located at 8756 Boynton Beach Boulevard in Boynton Beach in the Canyon Tower Center. Also, for more information on the Comprehensive Movement Disorders Program at Delray Medical Center, visit delraymedicalctr.com. See you next time on the Sideline Podcast.